Hi, and welcome to Revive and Rise. I'm your host, Melody Parrish, and I'm so excited to be with you today. And I thank you so much for spending your time with us. I have here in the office Dr. Reshma Khan. She's the founder and director of the Shifa Free Medical Clinic in Charleston, South Carolina, which serves the indigenous and uninsured population for healthcare and food insecurity with their food pantry. She's also the director of national resources for ICNA Relief, a social service organization. Thank you. And Dr. Connor, so excited to be with you this morning and just have this conversation.
Thank you so much, Melody, for having me on your podcast. It's an honor to be with you.
Yes, I want to just take a moment to tell you, you know, I volunteered during the COVID um, situation with you and the clinic, and that's kind of where we met. And I just have to say, those years looking back were the most impactful and beautiful years of my life, even though it was such a struggle during that time, I think, for all of us. But
That's
just
right.
seeing the beauty of the clinic and your work and the people that you work with and the tireless days that you spend, it's just amazing. So I want to thank you for your contribution to our community.
Thank you, Melody. Maybe we could not have done with volunteers like you, without you. So you were integral part of our service in that 2020, where you delivered so many home meals to the families in need. So we appreciate you as well.
Oh, thank you. And we'll dive right in. Um, our first question is that we want you to speak on the importance of healthcare in our communities right now and what you're seeing at the clinic, the trauma that you've witnessed in the clinic with your uninsured population of patients that you serve.
Sure. So healthcare is a basic human need and right. Yet, for the uninsured individual, it becomes a luxury. So over past 12 years, I've witnessed firsthand how limited access to healthcare impacts lives, especially among the uninsured populations. And these are the populations who often work in critical roles that support our communities, but they lack the resources or insurance coverage for their own health. These are people who are cashiers. These are people who are hospitality workers. These are people who are migrant workers. These are our workers who contribute significantly to the economy of our community. Now, imagine facing a health emergency or a chronic condition without the means to address it. The trauma of being uninsured is more than a financial trauma. It's emotional and it's physical. I have seen women postpone essential screenings or even prenatal care due to the cost, which can lead to preventable complications. In addition, the fear and the anxiety of an undiagnosed illness or an untreated condition can immensely create a cycle of stress and vulnerability, not just for the person, but for the entire family. And this trauma then affects the individual, it touches the family and entire communities. When a mother, for example, has to choose between groceries and healthcare, it impacts her health. It impacts her children's future and the community's well-being. Because then they have two options. Either they go to ER or they don't go to work, which both affects the economy of the community. Because in ER, the cost of a simple visit could be $1,780, whereas the same visit in a provider setting or in a clinic setting could be $150. So addressing these gaps, though through accessible healthcare, is not just about treating illness. It is about healing communities and fostering a sense of safety and support.
Yes, yes, that's so important. You know, I've seen the uninsured and people with healthcare needs totally just fall apart. And sometimes, when they are sick, they can't work and they can't support their families, like you say. And then what if they, die or
Yeah.
something, then where is their family? What's going to happen? Right.
Yes.
Um, well, you are an OBGYN by profession. And can you tell us more about what you have seen from unexpected pregnancy or from the inability to conceive, maybe miscarriages or other complications?
Sure. So, unexpected pregnancies can bring profound joy, but also considerable stress, especially for the uninsured women who may feel uncertain about how they'll afford the necessary prenatal care, the ultrasound, the delivery costs all add up. Often they feel caught between the excitement of new life and the anxiety of managing it without financial security or consistent care. So, this fear can lead them to delay or avoid seeking medical attention, which can increase risk for both the mom and the baby. So, at our clinic, we see that providing compassionate care, regardless of their ability to pay, helps reduce that stress and gives the women a safe space to navigate an unexpected pregnancy. Similarly, infertility is a deeply challenging situation, especially with limited access to healthcare. So, uninsured couples experiencing infertility are often unable to access the specialized testing or treatments that could help them conceive. The desire to become a parent is profound, and the inability to realize that dream can bring heartbreak, frustration, and even isolation. So, as a provider, I have seen how devastating it can be for a woman to feel that the door to motherhood is closed just due to lack of resources. This is why our clinic focuses on offering as much support as we can, even in cases where more advanced treatment are needed, by providing them with the guidance and the referral that they need to go to. The other problem is miscarriage. Miscarriage is profoundly personal and a painful experience. It's unfortunately common though. So for uninsured women, the trauma is compounded by lack of access for both immediate and follow-up care. So without insurance, many are unable to access the emotional support and the medical follow-up needed after miscarriage. And this can leave them feeling alone and unsupported in their grief. So as an OBGYN, it's incredibly important to me that we offer that compassionate care and resources to help them through their losses so they don't carry that burden alone. Most of the time, they want answers. They want to know why this happened or what was the reason. And just having that support with the provider, the conversation that the provider can explain to them that it's not their fault, that provides them the emotional support as well. So we are I feel very blessed that we have this opportunity as the free clinic that we can support these uninsured women in various stages of their pregnancies, infertility, miscarriage, or even as a general well-women care.
Oh, yes. And, I've seen firsthand how the clinic works and how much care you give to each person. And before with the prenatal care, and then after with giving diapers and other needs for the children to the families that aren't able to have. Um, so, Dr. Khan, can you tell us more about how your clinic combats these traumas of the uninsured?
So yeah, we obviously our clinic provides no cost care for women's health and also primary care, vision, and pediatrics. We are able to, with the collaboration from our local partners, including Roper St. Francis, LabCorp, Direct Relief, America's, a lot of different organizations that provide in-kind services to us, which in turn we are able to provide to our patients at no cost to them. This helps to elevate their burden. We can have no cost labs, they get their medications at no cost, they get the provider visits done at no cost. This accessibility is the key. And this allows the women to receive earlier care more consistently, reducing the stress of unaddressed health concerns. For many, just knowing that they have a trusted place to turn to provides relief from that constant worry that accompanies being uninsured. We have a full staff that can answer their questions. We are culturally and linguistically compatible with their needs and provide them answers as they go along. They can call us during the work hours, leave messages, and we can reach back to them and provide them the answers that they need. We empower women with knowledge that they need to make informed choices about their health. We also do workshops, we do one on one counseling and groups. We help women understand their reproductive health, manage pregnancy expectations, and plan for healthy pregnancies. Our team understands that each woman's background and culture shape her health needs. So we've tailored our services to be culturally sensitive, especially for the uninsured Hispanic population we serve. 50, more than, I think, 60% of our staff is bilingual. This has helped to build the trust, which is critical in healthcare. Women feel that they can openly discuss sensitive issues because they are in a culturally sensitive, understanding environment.
Yes, yes, that is so important. And I've found too, when you're with someone of a different culture, it means so much that you're taking that initiative and that extra step to talk to them in their native language, or to help them in some way.
Sure.
Yes. And now we're going to talk about the the way that you have seen mental health connect to physical health, because the trauma and the fear that maybe accompany the healthcare situation.
Sure.
Yes.
So the stress and the mental health challenges can actually physically manifest in numerous ways. For example, stress levels can disrupt your cortisol level. It can cause a high cortisol. It can lead to high blood pressure. And also conditions like polycystic ovarian even impact infertility. So during pregnancy, chronic stress can lead to complications like hypertension and preterm labor. Many women I see experience anxiety or depression, which can intensify during pregnancy and after childbirth. Mental health challenges make it harder for women to take care of herself, which can in turn then affect her nutrition, her sleep, her energy levels. This in turn impacts her overall health and recovery. And then trauma, untreated over a long time, can also lead to physical symptoms like chronic pain, digestive issues, and heightened stress response. For uninsured women, trauma may also prevent them from seeking preventative care or timely medical help. So, integrated mental and physical health care can make a tremendous difference. For example, counseling services for women facing infertility, pregnancy loss, or stress of an unexpected pregnancy can help overall improve her health and empower her to take care of herself.
Oh, yes. And I've seen the care of the clinic. You help so many different people, and you never, you know, give any favor to anyone. I've seen you help our ruthless friends, and I've seen you help those that are mentally challenged, and never once treating them any different than anybody
Absolutely.
else.
Absolutely.
So,
Yeah. It's a blessing to be able to be a part of this amazing clinic. And
yes.
yeah.
And I remember, during COVID times when you would step away from the clinic and go out into the homeless encampments, and
Yes.
give different vaccines, or give food, or whatever need there needs to be. And that is the dedication of a doctor. So I just want to thank you for that.
Thank you, Melody.
And the clinic also has a food pantry.
That's right.
So it's so much more than a clinic, because when you have food insecurity, that can also bring more stress, like you're saying, and affect your health. Um, but can you tell me how you have seen the effects of food insecurity affect health within your
Yeah,
clinic?
sure. So this food insecurity has a profound impact on health, and especially for the vulnerable populations. With this, it has increased risk of chronic diseases. Why? Because they have often to make difficult choices, prioritizing affordable, calorie-dense foods over healthier options. This can lead to poor nutrition, which is closely linked to conditions like diabetes, obesity, which in turn leads to hypertension and heart disease. Over time, limited access to nutritious food increases the risk of developing these chronic conditions, or if they already have them, it exacerbates them. Second, when individuals lack consistent access to healthy food, the immune system suffers, leaving them more susceptible to infections and illnesses. In my clinic, I've seen how patients with inadequate nutrition could take longer to recover from surgery or other health events simply because their body lacks the nutrients needed to heal effectively. For pregnant women, food insecurity is especially dangerous. Poor nutrition during pregnancy can lead to complications like low birth weight, preterm birth, and developmental issues for child. Additionally, women who are food insecure or mothers who are food insecure, they are at a greater risk of postpartum depression, which affects the ability to take care of themselves and the baby. It often insecurity leads to chronic stress, anxiety, and depression. The constant worry about accessing enough food affects mental well-being, which in turn then, as we talked about, results into physical health deficiencies. And the stress hormone, cortisol, we all know can worsen inflammation and can make it harder to manage existing conditions. And for those already managing health conditions like diabetes, this is a major barrier. Food insecurity is a major barrier. Patients are unable to follow a prescribed diet, impacting their blood sugar control or causing weight fluctuations. So over time, food insecurity contributes to health disparities in communities with fewer resources, and lack of consistent healthy food results in cumulative health issues, which then widen the gap in life expectancy and the quality of life between food secure and insecure populations.
Oh, okay. Yeah. And so talking about these pre-existing conditions and how your food affects that and your nutrition, can you explain to us how you've seen the food pantry help that and how the food pantry provides nutritious food to our families?
Yes, yeah. Our clinic's food pantry has been a crucial resource in supporting the health and well-being of our patients. Nowadays, at this particular moment, on a daily basis, we are serving about from a minimum 60 to a maximum of 106 families a day from the food pantry. And this has made a real difference. How? Number one, it improves nutrition and manages chronic conditions. Our food pantry provides access to nutritious food, includes fresh produce, fruits, eggs, dairy, all these foods that might otherwise be out of reach for many families. Lean proteins, meat. This access is particularly beneficial for patients managing chronic conditions like diabetes and hypertension. For expectant mothers, also, our food pantry support through nutrient-rich foods that support a healthy pregnancy and promote development. For families with young children, we also provide diapers that helps alleviate that extra stress on the moms and the families to buy the diapers. It is very expensive to buy diapers. Then second, food insecurity. Our food pantry also helps reduce the worry about families to redirect resources that they would have to spend on groceries or other essentials like transportation, medical care. So we also have a program where we provide home deliveries, and we partner with Amazon and the families that have registered with us for home delivery. We provide them on a monthly basis. About 100 families receive food through Amazon deliveries at home delivery as well. Then our pantry fosters a sense of community. A lot of volunteers are there, and those volunteers bring in with them sometimes food drives that they can do with their organizations and provide us with more food that we can give out, more healthy. So they would ask us, what is your need? And we would provide them what our protein needs are, what are the beans, what we need, and they would do food drives on that. That way we could provide more food. In addition, Low Country Food Bank being our biggest, being an agency for Low Country Food Bank could not have done without them. So they provide us with nutritious food. And in turn, they also connect us with retail stores like Publix, Harris Teeter, OP, and Target that donate food on a regular basis to us as well. Beyond food, we use our pantry as an education opportunity for education. We offer resources and guidance for healthy meal preparation, nutrition label reading, and budget-friendly grocery tours with the help of Low Country Food Bank to eat healthy. So patients leave not only with food, but also practical knowledge that helps them make better nutritional choices. We also put in their food boxes um, flyers that help them to understand the importance of good nutrition. And sometimes we could put food recipes that they don't know how. Suppose we have an eggplant in the clinic and they say, oh, I don't know how to cook an eggplant. So we can provide them with some recipes that they can try it out.
Oh, that's wonderful. And those resources are so important, Dr. Khan. One last thing. Um, the clinic does so many good things. It's not just a medical clinic, and that's the beautiful thing. It's just like a community of resources. And I know several people have said that, if they need something, they can always check the Shifa Clinic to see if that is able to be provided. Um, you do things like after school meals for those that are insecure. You do health fairs, school supplies, haircuts for children, hygiene kits. And what do you see in the future for the clinic moving forward?
So, looking ahead, our clinic is committed to expanding our impact through increased outreach, deeper community engagement, stronger collaborations, other enhanced education initiatives, and sustainability, which is a big part for our clinic to sustain itself. So, we plan to increase our presence in underserved areas, ensuring more families have access to the essential healthcare nutrition. We have planned in 2025, which includes more health fairs and screenings, especially in communities where transportation access to barriers prevent people from seeking care. And community engagement is at the heart of what we do. So in coming years, we work even more closely with trusted leaders, faith-based organizations, community advisory boards to ensure our services are aligned with community unique needs. So we aim to foster a collaborative environment where community feels empowered to give input and actively shape the services that we provide. We're working continuously on enhancing collaboration with our partners. We have 23 partner organizations that we work with, and with God's grace, these partner organizations have been with us for the last decade. None of them have withdrawn their support. So we now plan to make it even further. Going forward, we'll focus on even developing even more formal collaborations like shared programs and joint initiatives that address both healthcare and social needs. By working together, we can deliver a more holistic approach to healthcare and reduce health disparities in meaningful ways. No one organization can do it. We can just do it together. And I feel education is an essential to empowering individuals to take charge of them. So we plan on 2025 to offer more educational offerings through a grant that we received through Office of Minority Health, which through that grant we'll be able to provide nutrition workshops, chronic disease management classes, health literacy sessions. For example, diabetes self management and maternal health programs where we can help patients make informed decisions about their health, fostering long-term wellness. But to ensure we can continue serving, we are focused on a sustainable model that grows with the needs of a patient. So this includes investing in infrastructure, seeking grants, funding, and developing volunteers and workforce training programs. So with this approach, we aim to make a lasting impact and set a clinic in a way that we can serve as a blueprint for others looking to address health inequity. So we work only through donations, through grants funding. There is no income coming from from the people who we serve because everything is free for them. We do not take once they're eligible for a service, because for our service they have to be 250% below poverty line. They have to be uninsured. So we do not expect money from our clients, but we look forward to a community support through donations, through grant writing, and those are our two basic ways of sustaining ourselves. So we plan to work more on a sustainability, so this model can be sustained for a longer time.
Oh, that sounds so wonderful, Dr. Khan. And I just see you growing, growing, growing. You've recently moved to a larger clinic and encroaching on different communities is wonderful. I know one thing about your clinic, your food pantry, is that you don't have um, any uh, county lines. You don't just serve people in Charleston County or Dorchester County, which a lot of times is a limiting factor for um, other food pantries. And you're not just open 1 day a week or 2 days a week, it's every day. And
That's
that's
right.
very important for people,
That's
accessibility. So I want to thank you so much for that. And we look forward to all of the wonderful things your clinic and your staff are going to be doing in 2025.
Thank you, Melody. Thank you, thank you for having me on your show, and thank you for this honor. Thank you.
Thank, thank you so much, Dr. Khan. Okay. All right. Well, thank you so much, Dr.
Good.
Khan.
Yeah. I hope it was okay.
Oh, it's perfect. It's perfect. We'll edit it and then I'll get it over to you to make
Okay.
sure you like it. Okay.
Okay. Thank you so much, Melody. Thank
Oh,
God that we got it done.
I know. I know.
Yay! It was an accomplishment. Yeah.
Yes, definitely.
Yeah.
Well,
Okay.
you have a wonderful
You too.
day.
You too, Melody. Thank you. Bye.
Okay. Bye
Bye.
bye. Yeah.